All right. Hello, everybody. My name is Clem, the founder of StudentRDH. Today, we have very special guests. Completely different. We're not going to talk about the dental hygiene boards, the mock exam, and this and that. This is a special case that we have Cesar and Mari, and they're going to talk about their trip to Mexico. They volunteered. They helped lots of people there for their dental hygiene. So let's talk about that. Let's welcome them. Let me see. Can you hear this?
Yeah.
All right. This is for you guys. Welcome. So tell us what school you're going to and where you're from.
All right. Well, as you said, this is Mari. My name is Cesar Espinosa, and we're representing Fortis College out here in Phoenix, Arizona. And I'm actually 1 week away from finishing up school. This is my last week, and then I take my national boards in 2 weeks, and then Mari will be in her senior year. So in 6 months, she'll be graduating as well.
Perfect. So now let's just jump into the real story. You guys went on a trip. Tell us what the trip was about.
Yes. So this is a trip that our school holds twice a year, and pretty much what we do is these students that choose to go down to Rocky Point, Mexico, we go down there and actually provide different types of dental hygiene services for the community there that obviously doesn't have access to care like we do here in the States. So we're able to help adults, children, the older community, pretty much the entire community there. We're there to help in whatever we can.
Okay.
Yeah, basically anybody that can come, and we have 2 clinic days where we treat patients. So that's really nice. We're able to fit in as many as we can during that time.
Great. So I'm going to start asking questions, a point of view from someone who is curious. So first of all, how did that even start? Did your professor someday say, hey, you can sign up for this volunteering opportunity?
Yes. So this was actually my second time going. I went 6 months ago, and pretty much it's something that the school does every year, as I said, twice a year. So the students that choose to go, they pretty much pay out of our own pocket to go there. So this is not something that's covered by the school. We have to raise the funds on our own to go. So it definitely has to be something that you really care about, because as I said, it does come out of your pocket. So it really is something that you are passionate about and you really want to do.
Sure. How much was it?
It was $200 a person, and then you also had to cover your own, like where you're staying, your own travel,
food.
Yeah, while we're there. So, I mean, it adds up. It's 200. Technically, it's 200, but it ends up being probably closer to about 5.
I see. All right. And how did you find your accommodation? Did you all stay together?
Some of us we stayed in groups. So some of us stayed together in the same resort. And then there were others that just had like Airbnbs that were close by.
Okay. All right. So everybody really put that effort into, finding accommodation, finding their own food.
Definitely. Yeah.
Okay. All right. So how did you go? By bus? How does this work?
No, we pretty much carpooled.
Yeah.
So we pretty much found out who had the vehicle with the largest amount of space, and we just kind of used their vehicle, only because not only did we have to fit our bodies there, but also our clothing and also some of the materials and equipment that we were going to utilize. We also took that in some of our personal vehicles as well.
All right. So let's take let's imagine this. So you got, how many cars did you have in total?
Ooh, I believe
At least like 6.
Yeah,
At least
6 or
6
7.
or 7.
Yeah, so about 30 students went, including the faculty, right? Okay, so you all packed and you just drove down for hours.
Yeah, yeah.
Okay.
Correct.
You get to this town, what is it called again?
Rocky Point.
Well, Rocky Point. Okay, so you get there, you have your own accommodation. Now, what instruments did you bring or what tools?
So we pretty much just took the instrument kits that we normally use to treat patients in our clinic. Pretty much all the people that went, everybody took their own instruments. And when we were down there, we all just shared everybody's instruments there. And but luckily, we're really well set up at the community center that we work out of. So we have, we have sterilizers. We have, it's pretty much a dental clinic. We've been very fortunate to work with that community center now for a few years. So the school has been able to establish a really well dental clinic there. So everything was there that we needed.
I see. So you brought, if I understand, there's a community center there that's basically a dental clinic, has sterilizers, things that you would need, but there's some other things that you would need, such as instrumentation. And if I understand correctly, ultrasonic, the scalers as well. And just for, anybody who's wondering why, how I got connected to Fortis in Phoenix is because I forgot how it exactly started, but I got in touch with your program director and she was telling me about this program that she was doing. And I thought that was just fantastic. So StudentRDH did donate 2 ultrasonic machines. So everyone can use over here. So if everybody wondering why, how I got in touch and how I know about this program, this is why. But, really it's not about me or StudentRDH trying to do any marketing here. I just want to bring you guys' story here. So you have your instrument, ultrasonic, what about mask and gloves? Did you have to bring that as well?
We did, yeah. We had to bring everything. We brought plastic cups. We brought everyone's cassettes. So we have 2 at school that we bring, and then we just combined it everybody so that we could all share.
Okay.
We brought all of our syringes.
Okay.
And then pretty much every other material that we would need. So the only thing that was at the actual center itself was tables and chairs, and that was pretty much it. So we had to bring everything else.
Are they dental chairs or are they more like normal chairs?
No, they're like a beach chair that you would just recline in.
Yeah.
And then the chairs that we used for our own personal chairs were just like an office chair that had the wheels on them. So.
Yeah, it's definitely not the ideal setup. Obviously, we're used to here in the States, but given the circumstances that we were in, it definitely it works for what we're doing, and it allows us to be able to still treat patients. Now, where we worked out of personally, that's how it was, but they do have another dental clinic where they actually do some restorative things like fillings and extractions, and in that building itself, it is set up more like a regular clinic that you would see here in the States.
Yeah.
They do have is it 3 or 4?
I think they have 3 dental chairs.
3 normal what we see here type of dental chairs, suction units, a sterilizing room, but that was kind of in a separate building. Where we personally were at was where we had to utilize those like lawn chairs, I guess you could say.
All right. Well, at least there's something they tried, right? I mean, we all try what we have. So what does your day look like? Do you go there in the morning and just keep seeing patients?
Yeah, we would get there at about 8 o'clock, and we would leave around 5. So we'd see patients all hours in between. And then we had our lunch at about 12 o'clock, 12:30. But we would see patients in between. We had an hour with each patient for each student, and try and get done just as much as we could in that amount of time.
All right. What about radiograph? Was that available?
No, it
No.
wasn't. Unfortunately, a radiograph machine is still not present in the building, so we kind of just had to assess the current situation of each individual patient and pretty much just make a decision on what would benefit that patient the most, which was a really good experience for us as students because we were really able to use our skills that we were taught in school about diagnosing and just pretty much seeing what that patient would benefit from the most and what we could realistically do in 1 hour. Because as Mari said, we had 1 hour per patient. So if in that hour we could do only 1 quart of SRP, that's what we would do. If we could do a entire mouth cleaning, that's what we would do. So it all just kind of, it was a different treatment for every patient.
All right. I can only imagine the challenge. So you don't have radiograph, and of course, you know, what we consider the standard of care, obviously there's something we want in North America, but at the same time, we cannot say that it's for everybody. So you just have to be quick in your head, like, what do I see? What can I do? And I'm sure you guys did the best you could all day long to provide something for them, right? Then, you know, tell me when, you know, like a specific case, you know, Mari, I should say that. I think is that how you say that? I think I'm trying to replicate more. So what is one of your challenges you had over there?
I had a patient that was around the age of 20, he was 22, I believe. And I'm pretty positive that he had nugs. So treating him was just kind of, I didn't have the typical 5-day span that would ideally happen. So I just kind of had to treat as much of it as I could in that amount of time, even though sometimes it feels like not a whole lot. You know, just for someone who doesn't have access to dental care, it was a big change for him. So it was nice to have, you know, even if I could only finish the, you know, sextant that had all his lower anteriors, it was really nice to see that he was happy that was clean before he left.
Oh, wow. And did you see the symptoms like of NUG, which is, you know?
Yes, he had very punched out papillas. His tissue was really gray, and the odor from everything was very strong. So I just tried to, you know, get everything that I could in that amount of time done, and was pretty happy before he left. So that made me feel good.
Fantastic. I mean, you definitely change him in a positive way. Awesome. And I love that you're relating to what you have learned at school at NUG. I mean, the conditions of it, you know, this, you know, the papilla, the gray areas, the smell. I mean, you probably are a very good student. Great. So thanks for sharing that.
We're very fortunate. Our school has trained us very well. So
yeah. I can see that. Your program director, I mean, I spoke with a very passionate person, you know, I have no doubt. Now, Cesar, any challenges you had?
Yeah, you know, for me, it was more of a emotional challenge in a sense. You know, I myself was born in Mexico, and I was raised there for the first 9 years of my life. So until I came to the States, but so I know firsthand how it is not having access to dental care. I know how it is not having the basic education of dental care, period, you know. So being that I've been there before, to me it was more of an emotional challenge. A lot of these individuals that we saw, be it adults or children, this was their first time ever seeing a dental professional ever. You know, a lot of these cases that we saw, you know, we saw a lot of early childhood caries. We saw a lot of extensive periodontal disease, and also just gross decay in adults. And you know, a lot of times it's not that they didn't take care of their teeth. It was just a lack of finances. It was a lack of access to care and a lack of education that was never taught to them about the basics of oral hygiene. You know, I can recall a specific case. I had a woman who was about 40, 45, 46 years old, and I mean, it easily the most calculus I have ever seen on a patient. I'm talking about calculus bridges, like what you see in those crazy videos online, you know. It was a pretty bad case, and just talking to the woman, she felt really bad for the condition that her mouth was in, and just talking, you know, she began crying because she said how for the longest time she wanted to take care of her teeth, but she had 9 children, and that was just not something that was realistic for her. You know, she had to take care of all her children first. So just hearing her story and hearing her get emotional and cry made me get really emotional, and I almost started crying. I had to kind of separate myself for a few seconds, because if not, I was gonna kind of, you know, start tearing up myself. So as I said, I can connect with these people. I've been there, so I was just very fortunate and very happy that I was able to go down there and give back to my people, to my community, you know, and try to make a difference as much as possible.
Wow, I love the stories. I mean, treating someone, not just that lady who had extreme calculus and had 9 children, but just going back to your childhood and how you reflect on how things are different for you and how you can do something now, you know, just even the education, the one gesture that you guys did is just so much. And, you know, it's hard to say that they're going to keep doing that, or, you know, someone else needs to come and help them out as well. But, you know, that one gesture, I'm sure they felt it, and I'm sure you guys felt it. You know, I guess that's why we all need to do some sort of volunteering experience in dental, right? Did that, you know, things like that, did that change the way you see what your education is like right now? Like to, you know, reflect saying, oh, actually, like I'm doing the right thing. You know, school was difficult, but actually, you know, there's a purpose for this. You know, did that change a little bit?
For us, it allowed us to have a really big appreciation for the fact that we are able to do those things. We're able to give to the community and continue to do that. It's something that we can make sure that our classmates are aware of so that they can go on future trips. And also, you know, when we are hygienists, we can do that on our own as well. It's just something that makes this career even more right for us, you know, something else that we can do other than just being in our own clinic. We can give to others as well.
Great. Now, talking about skills, you know, at school, how many hours do you get per patient? I mean, sometimes it's like
a long time,
4, 10, you know, it depends on how many times you have to come back, right?
Yeah.
So from that experience to doing one patient in 1 hour, do you think that helped you practice your skills?
Oh, yeah.
Definitely. It just made you kind of prioritize everything really quickly. And that was really nice. And also just realizing how fast it goes, you know, knowing that at the end of school, we're going to have to do that on a regular day basis. So it just prepares you for the future of what you need to accomplish in an hour.
I mean, that's a great line to just add. If you were going to do on an interview saying, you guys, I know what an hour per patient looks like because I have done this. You know, not many people, you know, students get the opportunity to do that. So that is fantastic experience on top of school experience. Really love that. All right. So now let's talk about something fun, you know, that happened there. We talked about the challenges, but now anything you can share with us.
Oh, man. Well, I mean, personally, myself, it was just fun just being there and making a difference, you know. It really is. I know it sounds a little cliche, and, you know, hygienists always say, oh, you know, make a difference, but it really is for me. You know, as I talked to you a little bit about my past history, that's why for me it's so important to give back and to try to make a difference with whatever skills that we might have. I find community oral health and public health, I really grew a love for that being in school, which is why I decided to take on the role of the lead facilitator for our school's community oral health program for the last 2 years, because I am so passionate about helping others. I am so passionate about giving back to the community. And Mari is actually taking over that program now that I'm getting ready to graduate. So that's pretty cool to see that. But for me, as I said, honestly, the whole experience itself was just great. Just being there, making a difference, using our skills for whatever good we can do for people,
Awesome.
Yeah,
thanks for sharing.
We really tried to kind of like keep the mood light. We played music the whole time and kind of just interacted with the patients while they were waiting so that they wouldn't be so nervous. A lot of kids, kids get nervous when they go to the dentist, especially kids that haven't ever been to the dentist.
Yeah.
So that was really fun. And then we had a dinner for all of us that one of the nights on our last night. And that was just really fun to bond with our senior cohorts and our instructors. And so that was kind of like an experience that we wouldn't have gotten had we not gone. So
amazing.
We really all liked that too.
Oh, well, it's so nice to hear that. I mean, you blended a little bit, it's not crazy fun, but it's just, the things that you appreciate at the end of the day.
Yeah.
I really love it. I wish everybody could have the experience, but at least we're learning from you guys right now. That's what we're doing. And, we always say, as you say, it's cliche, say, there's so much to do. Dental hygienists can give back. But this, it's true. And I just encourage everybody out there to just connect with someone. Do you have any recommendation if any student wanted to participate or do something or know more about how to volunteer?
Yes, most definitely. I can't really comment for other states because I really don't know what types of programs are in other states. But here in Arizona, there's always different events going on where people could give back. For example, there's the Mission of Mercy, which they constantly are putting on events to provide free dental treatment. They have one that's specifically for U.S. veterans. So they'll get as many veterans as they can and provide free dental treatment. There's one that they do for the homeless. There's always things going on that you just have to do a little bit of research to find them. But definitely, it's something that giving back to the community is something that us as hygienists should always strive to do, just because that's part of our profession, and I feel like a lot of hygienists tend to forget that sometimes. Well, I shouldn't say a lot, but some hygienists tend to forget about that aspect of dental hygiene. They just start making good money, and then they kind of forget about the giving back part. But that's one of the main aspects of our profession is to give back to those who don't have access to dental care, those who need that help. So, yeah.
All right. So what was the name again? Something Mercy, you said?
Mission of Mercy.
Mission of Mercy is one of them that's in Arizona. Maybe they are somewhere else. But, I mean, there's, the web search nowadays. Just type it in. And, for example, if I recall, So my sister is a dentist, and she somehow got connected to other people, a bigger organization. They do trips to do exactly the same thing you guys did. So, she just searched through word of mouth. Word of mouth is always your professor. So, for example, your professor is the one who initiates all that. So, maybe even if you're not from that specific school, just reach out to any faculty member. Maybe they know someone, maybe they have done something like that. And there are also Facebook groups out there that, people talk, they talk about everything else in this world. So you can probably post your question there and someone can answer that. And just to add on that is, I feel like, so you guys did clinical, but you also combined education when you could, right? It's like,
definitely
tell them more about their teeth and why they should take care of this. And even though sometimes you cannot physically go somewhere and do clinical work, maybe in your community right here, there's some people who need basic education. Maybe give them the toothbrush. I feel like it starts from there. If someone wanted to take the first gesture.
Most definitely.
Yeah. Well, yeah, I mean, your story, your experience is really inspiring. I wish I did that when I was at school. And, there's no excuse for me to not do it more often than I want to, even though I work full time here at StudentRDH. But, it's really nice to see students being involved, things like that early on.
Thank you.
So, Marie, you are, was this your first time?
Yes. Yeah, this was my first time going.
All right.
And so I got to do a lot of the cleanings, and we kind of just swapped in and out. When somebody got tired, we went to another location, whether it was just sterilizing or helping the other students with whatever they needed. So it was a really fun experience that I would definitely recommend to anybody else. And if your school didn't have, a program like this, just reach out to anyone that you can to find an opportunity. There's always communities here, at least here in Arizona, there's always communities doing something for oral health, even if it's just OHI, it's something that's just so simple, that can help too. So, or just people as well.
Did you feel any language barriers? So Cesar, you obviously speak Espanol.
Yes, I do. Yeah, so that was one of the other reasons why I really enjoyed going and being able to help, was because, as you said, I am fluent in Spanish, so I was able to use that skill to have things go a lot smoother, a lot faster, because there wasn't that language barrier. Anytime anybody needed help translating, I was there. I was able to utilize my Spanish to be able to comfort the patients. As I said before, a lot of these patients, it was their first time seeing a dental professional ever. So they were nervous, they were scared, they didn't know what to expect, So I feel like having someone talk to them and educate them in Spanish really made them feel more comfortable and at ease, and really have more of a positive experience overall.
Well, I mean, I think your entire school benefited from you speaking fluent Spanish. The patients, I mean, your staff, this is amazing. Now, Marie, did you speak Spanish?
I do not speak Spanish.
Right.
So we just tried to pick up whatever we could.
All right.
Like frequently used words.
All right, let's share. Can you share with us what you've learned? Because there's a lot of trips out there that goes to those Latin American countries. Spanish is different in many different parts of those, countries, but there's something in common. And I'm thinking in my head, maybe brushing teeth is like something everybody can, learn. So, and just share with us some things that you have learned in Spanish words.
Well, simple things like abre, like open, cierra to close.
Okay.
Like asking if they're in pain. So tienes dolor. Tienes dolor is like you have pain.
Okay.
What did we ask more often? I feel like those are the three most.
Yeah, those are pretty much like the biggest ones.
Open, close, do you have any pain? Just letting them know that you're going to clean their teeth, like los dientes. How would you say, like the phrase?
Cepillar
los dientes is like
brush teeth.
Brush your teeth.
Okay, wait, we were going to rewind. Brush your teeth. What again?
She said cepillar los dientes, which means brush teeth. Yes, cepillar.
Cepillar. Okay, it's like Sebiar. No. Sebear.
It's Fepillar.
Okay.
Cepillar.
Pillar. Cepillar.
There you go. You got it. You got it.
I got this. Okay, now I visualize it. So, cepillar los dentes.
Dientes. There you go. You got it.
You said dientes or dentes?
Dientes with the I.
Dientes. Okay. Okay. So obviously those are called dientes, right? Okay. Okay, that's awesome. just brush your saying brush your teeth, cepillar los dientes. And if you want to ask it a question format, saying like, do you brush your teeth?
You just add a te at the beginning of the sentence. So te cepillas los dientes.
Te cepillas los dientes.
And then that turns it into a question.
All right. Okay. So this is great. Sepia, I never even thought about that word. I mean, I never heard that word in my life before, so that's awesome. And then, abre, that means like open, like like you say so abre. I always think about like ways to memorize things.
Yeah.
So sierra, like to sear a steak, like you just. In my head, I imagine a steak or a meat, and then you sear it, then you lock the moisture in, so you close it.
Yeah.
I remember. So we got that, and cepillar is something different, and I don't know how we can memorize this. Sepi. Well, I have to think about this a little bit.
You're trying to use your wake up technique.
Yeah, right? Memory techniques, exactly. Yes. To even learn languages, I mean, it applies everywhere. We have to, there's a lot of things to do in our life. So for those who do not know what wake up memory technique is, as StudentRDH and me, myself, I'm very passionate about memorizing techniques because we save a lot of time. We're a lot more efficient. Memory for drug names, especially, huge impact on us and our patients. So there are always ways to memorize it. So I'm trying to use the same technique to learn this Spanish. So thanks for sharing a few words of yours. Now, last thing I want to know in Spanish, like flossing. If I say flossar.
There's not really a specific word for flossing, but rather you ask if they utilize
Sure, yeah. And how do you what do you ask?
So you would ask like, usas hilo dental, and it means do you use floss?
Usar, okay, I heard that, so like using, like, so usar, flossar, no, flossar, what did you say?
No, you say,
no. Filos.
Usas hilo dental.
Usas hilos dentas.
Dental, yes.
Dental, okay.
You got it.
Yes, great. Yes, well, thanks for sharing those. At the end, I feel like, Marie, not speaking Spanish. I mean, this is just a great exposure to another culture. And you, Cesar, coming from that culture, being able to blend in. I cannot think of any better scenario over here. And, to be honest, I feel like you guys are very fortunate, and I really appreciate you guys sharing this story with us. So right now, StudentRDH and in Smarter Day, which is dental assisting exam prep, we have a lot of users, and I'm sure they would really love to know more about other ways to benefit as a student and benefit the patients. Now, before we wrap up, anything that I have missed that you guys wanted to share about the trip?
No, just that for a student, just try to volunteer at least once before you graduate, so that you have kind of that basis of appreciation, really, just for the career itself. I think that it will build hygienists that will really help in the future, and that's something that only can be built with an experience.
All right. And I mean, we do, you know, at the school, they built in some community programs for us. And to be fair, as a student, it's hard to appreciate those because you're like, oh, another requirement.
Yeah.
Yeah.
Most definitely. And, you know, just to add on just a little bit of what Mari was just saying, you know, we encourage all students to get out and volunteer at least a few times, you know, and it doesn't have to be going all the way to Mexico.
Right.
You know, it can be volunteering at your local dental charity or whatnot, you know, something local that will be easy to get to.
Right.
You know, a lot of times people that have never been exposed to let's say homelessness, to poverty, to things of that nature, you're not aware of that because you've never been exposed to it. But when you volunteer and you see that firsthand, it really gives you an appreciation, not only for your career, but for what you're doing to help people. It really helps to ground you in life, and really it lets you be more appreciative of what you do have, and it makes you realize that, hey, you know what, I have it really good. Like, things can be a lot worse. So we encourage all the students that are watching this video, anyone that's watching this video, to get out, volunteer, help your community, help those in need.
All right. I love the message. I love interviewing students because, you know, I cannot pretend I know everything at all. And, you know, real messages, you know, are what everybody's looking for. So, and I'm learning from you right now, you both and your entire school. So thank you for giving me the opportunity to interview you both. Now, very last thing, give a shout out to whoever you want to right now.
Well, I would like to say thank you to Ms. Lori Riedel, which is the director of our program. She's been great throughout my almost 3 years here in school. You know, anytime we've needed her for anything, she's been there. All the instructors at the school as well, and of course, in my personal life, all the people that have supported me and have helped me get to where I am now. So.
Yeah, classmates. I mean, we spend so much time with each other. We should pretty much be related.
Yeah, I know.
Thank you for constantly being the support system outside of our families. And you know, everyone at school, our instructors, Ms. Riedel, if she didn't create the program, we wouldn't have been able to go. So, you know, thank you to her, and then also our families for putting up with everything we throw at them on a daily basis. So.
All right, love the message.
For, you know, giving us this opportunity to speak about it and let other people know that it exists, and maybe they can create something in their community that they didn't have before. So thank you as well for that opportunity. Yeah.
Although I'm very thankful for you guys to take time, and this is their last day at school, so right before the summer break right now, they stayed at the school to be on this interview. Very thankful to have your honest story. So this is going to go out in the world and hopefully lives on to inspire more and more people.
I really do hope so. Yeah.
All right. Well, I'm sure we're going to meet someday, guys, you know. Let me know when you go to dental conference or something. I'm often in dental conferences, and I speak and things like that. So, you know, I know we met like virtually. I would love to shake your hand.
Yes,
that'd be awesome.
Definitely. Thank you so much.
We look forward to it in the future.
Yes. All right. Well, have a great summer.
You too.
You too.
All right. And be in touch, okay?
Bye.
Bye.
All right. Bye.